The purpose of this poster is to demonstrate the family illness experience and what factors influence the experience. A few important considerations are role changes, finances, and coping mechanism. As a group, we read through 12 articles and used 7 from the years 2006 to 2017 in order to focus on family illness experience using qualitative studies regarding role change, finances, coping mechanisms, and cultural implications.
For role changes, we found that family members of chronic illness patients experienced significant role changes and moved into a caregiver role at home. This caused them to have limited capacity to care for themselves, putting their own lives on the back burner. For culture, different cultures manage chronic illness in a variety of ways. We looked at a study about Iranian culture, who specifically uses spirituality rather than medicine itself when it comes to chronic illness. For finances, financial burden was one of the most widely discussed concepts in chronic illness care, and often treatment costs restricted family leisure time as medical needs were prioritized. For coping mechanisms, both parents experienced stress when children had chronic illness, and mothers were more stressed socially and physically, while fathers were stressed financially and psychologically.
The exemplar that we decided to use for this poster project was the book Inside the O'Briens by Lisa Genova. This book fits really well with our construct of family illness experience, as the O'Briens find out that their dad was diagnosed with Huntington's disease, which unfortunately is a chronic illness. Throughout the book, the family has to deal with coping strategies as well as financial burdens with this illness, as well as their 3 children have to decide if they want to find out if they have the Huntington's genes or not. Below, on the bottom of this poster, is a picture that represents the percentage of the population that are currently suffering with chronic diseases.
Some recommendations for nursing practice that we chose was educating patients and families on resources available to them, as well as educating nursing staff about cultures they may be working with to help them best work with patients and their family members. And some questions for considerations would be, how can nurses help take pressures off of family members as they play a new role as a caregiver in the family? And how can nurses reduce the financial burden placed on families during and after treatment?